listening to part 7 of our 12-part series, A Healthy Heart the Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Hi, Gemini. Once again, I am just delighted to be here with you. What have we been doing so far? We've been looking at the heart as source of emotions, as a rememberer of emotions, as a causer of emotions, and then we've been looking at how the heart is tied into the brain and the nervous system. And now, this week, we have gotten to one of the key and critical issues in heart health, and that is inflammation. Roughly half of those who have a heart attack in westernized countries are not at risk. They're not at risk by the classical assessments. That is, their cholesterol and blood pressure within normal range. Their body mass index is between 23 and 27, and they have no family history of heart disease. What? Well, they're not at risk for a heart attack, and yet half of the people who have heart attacks don't seem to be at risk. What could possibly be going on? What has triggered these heart attacks? The answer is quite simple. Inflammation. Inflammation has triggered these heart attacks. Endothelial cells line the inner surface of all blood vessels. Ideally, they form a slippery interface between the circulating blood and the blood vessels themselves, allowing blood to flow smoothly. But when endothelial cells get inflamed, they break down and they cease to function well, and then the inflammation spreads throughout the circulatory system. So inflammation can start in a localized place, and we're going to be, as we move through our weeks together here, looking at the fats in our diet and how the fats in our diet influence inflammation in the endothelial cells. So when they are inflamed, when they are disturbed, when they are hurt by harmful fats, when there is too much LDL cholesterol, when the LDL has been oxidized, then these cells that line the blood vessels break down. And this triggers inflammatory process throughout the circulatory system. Medical researchers have accumulated an enormous amount of data demonstrating that inflammation, both systemic and local, plays a key role in the development of atherosclerosis and heart disease. Inflammation is the trigger that gets the ball rolling. First, endothelial cell swelling, then plaque formation, because the cholesterol plaque is doing its best to cover that rough spot. When the endothelial cells swell up, they make a bump. They're supposed to be making things smooth, and suddenly there's like the opposite of a pothole. There's like a speed bump there. And cholesterol comes and tries to kind of pave over it and make it okay. Then the breaking away of that plaque, which triggers a heart attack or stroke. Inflammatory reactions in coronary blood vessel plaque lead to heart attacks, while inflammation elsewhere is associated with blood clots and strokes. Reduction of the inflammatory response leads to plaque stabilization and reduction of risk for both stroke and heart attack. So we have a pretty clear picture here. We know that there are certain things that we think would lead to heart attacks, and we would say high blood pressure, high cholesterol, family history. But what we're finding out is that this isn't enough. It's not enough to show us who's really at risk of a heart attack, and who's really at risk are people who have inflammation. Let's look at how we test for that inflammation, and let's look at how we can deal with that inflammation. Various tests have been developed to find markers of inflammation. There are tests that look for high C-reactive protein, for increased white blood cell count, for high amounts of serum amyloid A and or large amounts of albumin or fibrinogen in the blood. And various of these tests are used at various times in order to see whether or not you've had a heart attack, for instance, or perhaps whether or not you're at higher risk for them. C-reactive protein is a test that is becoming more and more popular and easier to get. And C-reactive protein, just as its name says, is a protein that is caused by a reaction to inflammation. So when there's inflammation in the blood vessels, in the circulatory system, then C-reactive protein is made. And we can see that C-reactive protein in a pretty simple blood test. A heart attack is more likely in a person with normal cholesterol and high inflammation than in a person with high cholesterol and little or no inflammation. I know this is rather stunning news to some people because they're so used to thinking that it's high cholesterol that leads to heart attacks. But in fact, as we are going to be seeing, the cholesterol hypothesis has never actually been proven. It is a hypothesis that high cholesterol leads to heart attack, and despite the fact that we have millions of people taking cholesterol-lowering drugs, we still can't say with any assurance that that's doing them any good at all. A heart attack is more likely in a person with normal cholesterol and high inflammation than in a person with high cholesterol and little or no inflammation. Lowering inflammation is one of the key things that we need to do to regain and to maintain a healthy heart. When healthy, middle-aged, and elderly people have subclinical infections, it leads to increased heart rate and reduced heart rate variability. And those with rapid heart rates and low variability have increased mortality and more blood vessel disease. Though it has been looked for, no link has been established between common unsymptomatic long-term infections like chlamydia, herpes, heliobacter, and heart attack. The link is to the inflammation, not to the infection. Nevertheless, it may be worth trying herbal anti-infectives such as echinacea if you are over 60 and have an unexplained rapid heartbeat. Aspirin is an anti-inflammatory drug at low doses, as little as 81 milligrams, a quarter of a standard tablet. It helps prevent heart attack and ischemic, that is clot-related strokes. Low-dose, long-term aspirin therapy has been in use for a long time now, long enough for the severe and sometimes deadly problems it can cause when used by otherwise healthy people to become discernible. Aspirin reduces the tendency of the blood to clot. That is, it thins the blood. Now, thinning the blood sounds like it should be good. We started out by saying there's these endothelial cells, and they can get inflamed, and they're supposed to make the way smooth for the blood, but when they get inflamed, they make it bumpy. And we're saying, well, we'll just thin out the blood. Well, just, it's like if you had something running through a pipe, which is what a blood vessel is, and you find that it's not coming through well, you might say, let's thin it out, and then it will move through more easily. And it's true. There's nothing wrong with the logic of that. Even at low doses, however, blood thinners can cause internal bleeding. Aspirin can cause internal hemorrhage in the stomach and the intestines, as well as ulceration of their surfaces. And thinning the blood actually increases the risk of hemorrhagic stroke. There are two kinds of strokes that we can have. We can have a stroke from a hemorrhage, or we can have a stroke from a clot. Both interfere with the blood supply to the heart or the brain. If the blood supply to the heart is interfered with, it's a heart attack. If the blood supply to the brain is interfered with, it can actually kill us. Ditto if the blood supply to the lungs is interfered with. So that's one kind of stroke, the clot stroke, and the other kind, the hemorrhage stroke. I think that we can see they need to be treated exactly the opposite. If there's a clot, we need to bust it. If there's a hemorrhage, we need to stop it. And it's very difficult to tell which is going on, if there's a heart attack, if the person is having a stroke. Do we know if it's a blood clot or a bleed, which is a hemorrhagic stroke? We don't. And so in one of the marvels of modern medicine, we have decided that all people over a certain age should be put on blood-thinning drugs so that when they have a stroke, we will know it's a hemorrhagic stroke and we'll know how to treat them. Doesn't make a lot of sense to me, but I don't think it's completely nonsensical either. The Preventative Services Task Force suggests that low-dose aspirin therapy can reduce heart attack risk when used by men aged 45 to 79 and reduce ischemic stroke risk when taken by women aged 55 to 79, but only if these men aged 45 to 79 and women aged 55 to 79 are at high risk for cardiovascular disease if they have angina, if they have had a heart attack, or if they have had a blood clot. In other words, it's not most of you. If your doctor has suggested that you take low-dose aspirin therapy and you are younger than 45 for a man or 55 for a woman, the Preventative Services Task Force is saying this is not for you. If your doctor has suggested it and you are older than 79 and either a man or a woman, the Preventative Services Task Force is saying this therapy is not for you. And furthermore, they are saying that low-dose aspirin therapy is only effective for people who are at high risk for cardiovascular disease, have angina, have had a heart attack, or have had a blood clot. The risk-to-benefit ratio for those who do not fall into these categories is not favorable. So, once again, it seems simple, it seems easy, it seems like something we can do to help take care of our hearts. We can just go to the drugstore and get some baby aspirin. As a matter of fact, I'm even seeing it sold as for heart health. Take a baby aspirin every day for your heart health. This is not as simple and straightforward as the commercials would have you believe. Let me say again, if you're a woman between the ages of 55 and 79, or a man between the ages of 45 and 79, and you are at high risk, have angina, have already had a heart attack, or have already had a stroke, aspirin therapy is definitely going to help you. If you're not in those categories, it will probably harm you more than it will help you. Instead of aspirin, why not try anti-inflammatory herbs and foods? Some act more like aspirin, and some have some of the same compounds, but fewer side effects, and some act more like blood-thinning drugs, but work through a variety of pathways that aren't available to drugs. You can choose an aspirin-like herb to work with, or a blood-thinning herb to work with, or you can rotate through your favorites. You don't just have to stick to one. What we want to do is reduce our inflammatory markers and keep those inflammatory markers down. There is a long list of aspirin-like herbs. My favorites are willow, birch, poplar, and black haw. Willow, salix, in both the buds and the bark, contains salicins. Salicins, if that word sounds kind of like something you might have heard before, you're on the right track there, because aspirin is salicylic acid. And salicins are easily converted into salicylic acid in your body, or by being soaked in vinegar. Here it is spring. If there's a willow budding on your block, maybe snip off a few pieces of that budding willow, tuck them into a jar, and pour room temperature apple cider vinegar over it. A tablespoon of that is about the equivalent of 2 regular aspirins. So a tiny bit of it on your food would be the equivalent of a baby aspirin, or you can use it once or twice a week in a more lavish quantity. I don't know if it's still available, but many years ago when I worked in health food stores, there used to be a tablet of willow bark. It was just a tablet of compressed willow bark, and it was sold in a little metal tin that you pushed the corner of to pop it open, just like aspirin. It was small enough to just tuck into your pocket. I think there were only 6 in it. And I really liked the packaging and the presentation of willow. And while we're on willow, I also have this very strong memory of an advertisement that someone sent me. We see the doctor seated at his desk, shelves and shelves of books behind him, and he's on the telephone. And the caption says, "Take the bark of 2 willows and call me in the morning." And the text says, "Aren't you glad you don't have to do that? Aren't you thrilled that you have modern drugs?" And I am sometimes thrilled that we have modern drugs, but I think we can all admit they're being overused, especially when it comes to countering inflammation. Birch bark and birch leaves can be used in the same way that willow bark and willow leaves can be used. Birches can be quite high in salicins, and making a vinegar with any fresh part of the birch can extract that and turn it into salicylic acid. Now, let me be clear when I am talking about bark here, because herbalists do this kind of funny thing, and that is that we use the word bark as a kind of code word. Now, yes, it really means bark. Well, no, it doesn't really mean bark. Yeah, you can see why it's a bit coded. When we look at a tree or a shrub with bark, what we first see is the bark. It's the outermost layer, and it is dead. The cells are dead. And behind the bark is the living layer, sometimes called the inner bark or the cambium layer. And this is what herbalists use. When we say bark, what we really mean is inner bark. One of the reasons that this kind of symbolic use of the word bark has come about is in the vast majority of cases, we don't go out, cut down a tree to get its bark or its inner bark. In this case, we take small branches off the tree. And if you want to try this out, you can. It's pretty easy, especially if you have access to a willow. You cut off a piece of the young willow branch, which is very flexible, and you scrape it with your fingernail, and you will see that there's like some, just like a layer of coloring matter, which will become the bark. And right under that is a softer, juicier, although still fibrous texture, and that is the inner bark. So it's the inner bark that herbalists are using. We are not tossing chunks of willow bark into kettles and boiling them up, nor are we doing that with the birch bark. Although some of the birches, even the outer dead bark, carries some salicin, and in an emergency can be chewed. Poplar leaves and buds are wonderful, fragrant sources of aspirin-like compounds, as is black haw. There are foods that are rich in salicylates, too, and they include dried apricots, prunes, dates, raisins, and dried cranberries. Is there a theme here? I think all these things are dried fruits. I wonder if there's something about drying fruit that makes the salicins in them more available to us. We also find salicins in fresh grapes, raspberries, strawberries, pineapple, citrus fruits, and avocados. Again, I return to my theme. Who says being healthy and taking care of your heart has to be onerous and yucky and bitter? These are wonderful, wonderful foods. Oh, I see. You have to eat apricots, prunes, dates, raisins, cranberries, grapes, raspberries, strawberries, pineapple, citrus fruits, and avocados for the health of your heart. Poor us. Blood-thinning herbs such as sweet woodruff and her gallium sisters. Also, sweet clover, ginkgo, chamomile, red clover, and blazing star are blood-thinning herbs. Blood-thinning foods such as ginger, garlic, cinnamon, and turmeric are also available. All of these blood-thinning herbs and foods help prevent stroke and counter inflammation. Cayenne is said to bust clots at the root and is likened to herbal anticoagulant therapy, but I am hesitant about it. And I will delve more deeply into my hesitation about cayenne with you in the 12th of these radio shows, so we will come back to it. I drink red clover infusion regularly and eat dried fruit and garlic on a regular basis too. But when it comes to anti-inflammatory herbs and foods to keep my heart healthy and to regain heart health, there are three that I rely on and could not do without. And those are leafy greens, linden flowers, and extra virgin olive oil. Leafy greens are powerful anti-inflammatories. Most people go, huh? They don't think of those greens that we eat. And by greens, I mean amaranth greens, lamb's quarters greens, chicory greens, beet greens, nettle greens, dandelion greens, spinach greens, garlic mustard greens, Swiss chard, red and white cabbage, broccoli de rape, Chinese cabbage, bok choy, collard scale, mustard greens, and Chinese greens, all of which are Brassica oleracea. Leafy greens provide more nutrients for fewer calories than any other food on your plate. Their abundant minerals help blood pressure stay low and the nervous system stay strong. Their antioxidant pigments, especially lutein, are green blessings that reduce risk of heart attack and stroke, as well as helping to prevent atherosclerosis. Proteins and fibers found in cooked leafy greens bind to cholesterol deposits in the arteries and clear them away. So be sure at least one meal a day has a big serving of nutrient-dense, calorie-light, heart-healthy leafy greens. On the anti-inflammatory index, leafy greens rank near the top. Spinach is 466, kale is 439, collards is 379, and Swiss chard is 243. On the glycemic load scale, leafy greens are at the bottom of the chart, with the highest on that scale being 100. Cabbage and spinach are 2, kale and dandelion 3, collards and amaranth 4. So you can see wonderful, wonderful effects, because glycemic load, we want to get foods that are lower on that glycemic load scale. Leafy greens contain generous amounts of potassium, which acts as a vasodilator, opening up blood vessels, lowering blood pressure, and reducing angina. Leafy greens also offer an abundance of magnesium, potassium, and calcium, that heart-healthy trio, so important to the electrical and emotional functioning of the heart and the nerves. And leafy greens are exceptionally good sources of folate and vitamins B1 and B6, nutrients that moderate the levels of homocysteine, an amino acid whose presence in the blood contributes to clogged arteries and heart disease. Nearly half of the men, about 43%, and a third of the women, about 34%, who have arterial plaque have high levels of homocysteine. Boiled, not raw, spinach has been shown to lower homocysteine levels. In fact, all cooked leafy greens are very, very helpful in lowering homocysteine levels and thus relieving stress on the heart and the blood vessels. Why am I a smiling fan of cooked leafy greens and a snarling ogre about raw greens? First, raw greens are risky to your health. The Center for Disease Control says that half of all cases of food poisoning are from raw fruits and vegetables. Second, little or no nutrition is available from raw greens. Cooked spinach has more than twice the available nutrition of raw spinach. Cooked broccoli has twice as much available nutrition as raw florets, and cooked cabbage has 50% more nutrients than raw cabbage. Third, it is easy to eat lots of leafy greens when they're cooked. As they cook down, try to force yourself to eat a pound of raw spinach, and not easy. And try to keep yourself from eating a whole pound of spinach once it's been sautéed in butter with some sliced garlic. Oh, heavenly. Cooked, not raw spinach, supplies biologically active pigments such as beta-carotene, lutein, and xanthine, which are powerful anti-inflammatories. A component of spinach, CoQ10, helps muscles stay strong as we age. And remember, the heart is a muscle. CoQ10 has been used to prevent high cholesterol, heart failure, hypertension, and coronary blood vessel disease. And this was fascinating to me. Rabbits and pigs exposed to lethal doses of uranium and X-rays were not killed if their diets contained leafy greens, and in the study that was done, the leafy green they used was cabbage. Rabbits and guinea pigs exposed to lethal doses of uranium and X-rays were not killed when their diets contained cabbage. Cabbage is an exceptional source of the anti-inflammatory glutamine. You have heard me talk before about Linden. And again, if you want to go back to the Time Monk archives when we were talking about colds and flus, I talked quite a bit about Linden and mentioned at that point that Linden is one of my favorite anti-inflammatories. I make sure that I am drinking at least a quart of Linden a week, just to, in general, keep the inflammation load on my body as low as it can be. If you want to drink more Linden, there certainly would be no problem for that at all. You might want to check out the wonderful YouTube that was made of the apprentices and myself harvesting Linden at a local shopping mall. If there's a Linden Avenue near you, then know that there will be Linden flowers there later on in the year. The Linden flowers come out in the summer, and they smell marvelously sweet. And olive oil. I remember the story. There was a conference being held in Italy, and it was a conference on non-steroidal anti-inflammatory agents, right? Acetaminophen, ibuprofen, and aspirin are generally considered the non-steroidal anti-inflammatory agents, or NSAIDs. And one of the MDs present was at the dinner table, and there was a bowl of olive oil. He stuck his finger in it and put it in his mouth and gasped, because he was a scientist who worked with the these anti-inflammatory compounds, and the olive oil tasted just like it to him. He proceeded to focus a bunch of studies and to prove that olive oil is indeed a powerful anti-inflammatory and one of the most important fats to have in the diet of the person who wants a healthy heart and healthy blood vessels. We're going to be talking more about healthy fats next month, but I'll leave that thought in your mind. Come and visit me at SusanWeed.com, and this week your assignment is to eat more leafy greens, cooked leafy greens every single night this week, okay? All right, green blessings.
Thank you, Susan. This concludes part 7 of our 12-part series, A Healthy Heart, the Wise Woman Way, with Susan Weed at Time Monk Radio.